In 2015, major market barriers and challenges prevented HIV self-testing introduction in low and middle-income countries, the lack of pre-qualified products coupled with uncertain levels of consumer demand. There was lack of evidence on public health's impact and cost-effectiveness and how it should be implemented. There was no normative guidance to support HIV self-testing.
Well, at the same time in Zimbabwe, a 4-year groundbreaking trial on HIV self-testing has been launched. The HIV Self-Testing Africa project, known as STAR, is the largest ever evaluation of HIV self-testing on the continent. The aim is to inform World Health guidelines and policy.
Simple 3-step test to determine one's HIV status. First, swab the lower and upper gum once, then insert the device in a vial containing a solution. Within 20 to 40 minutes, the results are out. In the first phase, 750,000 of these test kits will be available in Zimbabwe, Malawi and Zambia.
STAR was an epitome of a successful collaboration that introduced an intervention and catalyzed its scale-up. It was a collaboration of researchers and implementers, with the research being led by global research leaders from London School of Hygiene and Tropical Medicine and Liverpool School of Tropical Medicine, and the implementation led by highly experienced teams from PSI. In all our work, we worked closely with WHO, including in the formulation of research questions. We conducted research in all stages, it spanned all stages, including formative research through to very large impact evaluations of different models of distributing HIV self-test kits.
Ndithu akumakamba kunena kuti tikulephera kupita kuchipatala nkhani yake ndi kutali komanso noja mwina chinsinsi. Kumbali yokuti ndikugwira ntchito tsiku langa limakhala lopambana kwambiri, makamaka ndikakhala kuti ndapeza anthu ambiri amene afuna kuti agwiritse ntchito njirayo.
Ine makaso ngamunyidzira mapanga ngati mlangizi wazamoyo amene kalingerezi na CBT.
Kuziyeza wekha kumafananabe pang'ono ndi njira inayi, mwachisanzo ngati njira kuchipatala ija kuti tiziyerekeze zinthuzi. Kufanana kwaye ndikuti munthu akudziwa za nthupi mwake mmene mulili. Njira yakuziyeza wekhayi mwina ubwino wake kusiyana kwaye pang'ono mwina komwe kungakhalepo ndikuti zimene unazo njirayi ndi yachinsinsi ndi.
Hello, morning, sir. A lot of people coming now, mainly men that never used to appear. Now they are coming, get the test kits, and then they go home and test. So it's good for them, and they've really welcomed it because now they can as well know their status. Most of them know that it's a finger prick. Now for them to find this oral test, they ask me how effective it is. So they want us to explain, and when we explain, they become so happy because some are so nervous. They hate being pricked. This one is an advantage. As they knock off, me I close late, they will find me here, they will collect, go home and test themselves. Those that come out positive with the cards, we refer them to the clinic, the health facilities, for them to go and get the confirmatory message from that side or result.
We want to use it as a strategy to reach the normally unreachable people in terms of having access to HIV testing and treatment for Lusaka, some districts in Lusaka and on the Copper Belt. To guide the implementation of self-testing, we've come up with the HIV self-testing national strategic plan. So that is going to guide the implementation of self-testing.
decided that we needed to bring testing to the people, to where they are every day, rather than expecting them to come to us in their busy lives. And taxi ranks are a place most of us move through each day. We did a baseline survey in all the same ranks and asked the people that come to the ranks what they want, where they want to get their tests, and we learned a lot from the responses and designed the approach accordingly. So we're really targeting mostly our men, our male commuters, our male taxi drivers.
People explained me how this thing works, and he gave me even samples, and we fear to go to the clinic so that we can make some HIV test. So if I do it on myself, on my own at home, it's quite simple compared to do it in a clinic.
We already provide, when we give them the kit, the referral information and a number of ways they can link. At the end of day 6 of our campaign, we'd already distributed about 70,000 kits. Remember, we're working in 12 ranks across Gauteng, the biggest ranks, and we're distributing roughly 10 to 11,000 self-testing kits a day.
We have the peer educator who provides health education to our patients, whereby he explains how the HIV self-test kit work.
In the military, we like this self-testing, especially because, it is not easy for people to go for testing because of the stigma. People are scared to go and be tested by the people they know.
Atlas, c'est l'innovation.
La confidentialité.
Connaissance de son statut.
Un des objectifs du projet Atlas, c'est d'arriver à toucher des gens qu'aujourd'hui on n'arrive pas à toucher par les programmes traditionnels. Plus de 300 000 kits ont été distribués dans les 3 pays, en majorité en direction des populations clés. Globalement, on a aussi des stratégies où on va vers les populations cibles. Ça représente autour de 86% de la distribution. On a vraiment rencontré un engouement et un intérêt en lien avec ce qu'apporte l'autodépistage en termes de confidentialité, de gain de temps.
Nous avons constaté l'acceptabilité qui est particulièrement importante. Plus de 90% des personnes qui recevaient les autotests acceptaient de les prendre et de les mettre à la disposition de leurs partenaires.
Tous nos résultats montrent que l'autodépistage du VIH, c'est faisable, acceptable et c'est soutenable sur le long terme. Donc cette perception de ne pas être à risque veut dire qu'on atteint des personnes qui sont moins enclines à accéder à des structures de santé pour aller faire une démarche volontaire de dépistage. En croisant indirectement différentes données, on arrive à montrer que dans les zones où on a dispensé l'autodépistage, on a augmenté l'accès au dépistage sans réduire l'accès au dépistage classique. On a aussi un nombre significativement plus élevé de personnes qui ont été dépistées positives.
Ce qu'on cherche à faire, c'est de simplifier, accélérer, transformer l'accès aux soins. L'autotest est aujourd'hui un des éléments majeurs de la stratégie contre le VIH.
Nous avons les autotests qui sont disponibles au Sénégal. Nous avons une stratégie nationale que nous sommes en train de décentraliser et nous avons même l'ambition d'aller dans le privé. Les autotests VIH font partie maintenant du standard pour les dépistages VIH du Sénégal.
Nous avons donc les outils élaborés, le guide national d'autotest qui vient justement d'être révisé. Nous comptons surtout mettre à disposition de l'autotest au niveau du grand public parce que nous avons créé le besoin.
Il est très important que 300 000 tests aient été faits dans le cadre de ce projet. Au-delà du système de santé, on ait pu valider le fait que c'était possible dans le cadre communautaire.
On est vraiment content à Soltis d'avoir pu avoir ce partenariat avec Unitaid parce qu'il a permis d'utiliser un modèle qui ressemble au modèle Soltis, c'est-à-dire de commencer par un projet dans lequel on teste des solutions. C'est parce qu'on a eu ces résultats qui étaient très positifs qu'on a ensuite travaillé avec le ministère de la Santé, aidé par l'OMS, pour avoir une politique nationale dans laquelle est inclus l'autotest VIH. On a été plus loin, puisqu'au niveau de la région aussi, on a eu des pays qui ont fait la demande d'inclure l'autotest dans leur stratégie nationale, au vu des bons résultats qu'on a pu produire sur notre projet Atlas.
La communauté est en marche vers l'accès au test, donc l'accès au traitement, l'accès à la charge virale, l'accès à la fin du sida. C'est ça ce que ça veut dire l'autotest.
And how important is it to know your status, you know?
Extremely important. I really encourage everybody to test as regularly as they can.
Okay, so you swab along the gums, once at the top and once at the bottom to get the cells.
Does it hurt?
Oh, it's not that type of test. No blood, no needles, just the swab. Okay, so put it in the bottle. Then we wait for 20 minutes.
What if one of us we're both HIV positive?
Okay, then we will know, and then we'll go to the clinic to get the help that we need.
Negative. We're both negative.
Oh my gosh, it's so much sexier when you say it in French. Negative.
Mais faisons. Mais là, j'ai peur. Faut pas avoir peur. Je le fais avec toi, non?
C'est parce que tu n'as pas beaucoup de garçons comme moi. C'est pourquoi tu parles comme ça, non?
C'est vrai que Benny, c'est mon seul mec depuis longtemps, mais ça ne veut rien dire, ma soeur. Il faut toujours connaître son statut pour avoir le bon comportement. Toi, allons-y. Arrête de stresser.
Non. Comment? Grasso, je suis séronégative. Non. C'est pas possible. Il y a forcément une erreur.
Il n'y a pas d'erreur. Tu as bien entendu le pharmacien. L'autotest est très fiable.
Oui, c'est vrai qu'il a dit, hein? Mais il a aussi dit qu'on peut le confirmer à l'hôpital, même quand c'est positif.
Comment je vais expliquer ça à Benidji?
By the end of July 2020, more than 5 million HIV self-test kits had been distributed across Unitaid's HIV self-testing investment in 9 countries across sub-Saharan Africa. 88 countries had policies which allowed HIV self-testing, and country policy adoption continued to expand. STAR and Atlas implementation evidence informed the updated WHO 2019 guidance. The number of pre-qualified HIV self-test products grew to a competitive market, and investment by Global Fund and PEPFAR and country government had increased significantly.
Some of the key outputs from the research that STAR conducted include 63 publications, 28 of which were led by a first author from an African country, with 18 satellite sessions at the international AIDS conferences.
The investment of Unitaid in STAR Phase 3 aimed to establish the structures and systems necessary for long-term sustainability of HIV self-testing in 7 countries across Africa and Asia, using a total market approach. This was to pave the way for the Global Fund CIF Matching Fund catalytic investment in the STAR 3 African countries.
National AIDS Control Program in India has always utilized the cutting-edge technologies and new techniques in combating AIDS.
This is the first project which was aiming to reach more than 1 lakh study participants in coordination with NACO.
WHO has been partnering with the STAR initiative in multiple different countries.
I think this came as an opportunity where people can go without going to hospital. They can actually access the HIV testing services in their own privacy, in their own confidentiality, and they can feel more comfortable.
Communities are best placed to inform an initiative like this because of the reach that they have.
HIV self-testing kit was kind of a gift for a lot of people who were afraid to get tested, who were afraid to go to these kind of centers where they will feel discriminated and stigmatized. And also the plus thing is it's not only working for transgender people, but it is also working for their intimate partner.
India does have this opportunity right now. There has been a lot of implementing experience that shows how to get this done in India, and it is now time to scale up.
catalytic impact of the STAR project very quickly transformed HIV self-testing into a high-growth market. Availability of more than one quality-assured product was critical in ensuring supply security and generate significant cost savings. Unitaid and Population Services International concluded unique pricing agreement with Viatris and Otomo. As a continuation of work under early market access vehicle, Unitaid and Population Services International had a unique pricing agreement, this time with Abbott, for its WHO pre-qualified product known as Check Now, to fix the final landing cost at the $1.79, valid till December 2026 for the public sector procurement across low and middle income countries.
The successful introduction and scale-up of HIV self-testing through the Unitaid investments provided a roadmap for other self-testing interventions. The evidence generated from STAR informed WHO guidance and recommendations for HCV and COVID-19 self-testing.
Tôi nghĩ rằng việc ra mắt một bộ tự xét nghiệm viêm gan C thì sẽ là một bước tiến rất lớn cho Việt Nam. Và tôi rất hào hứng khi có thêm một lựa chọn nữa để làm xét nghiệm viêm gan C thường xuyên. Và đây là một cái cách làm rất là mới để có thể chăm sóc sức khỏe của bản thân mình cũng như là cộng đồng.
The client is registered and screened for any COVID-19 symptoms and risk factors, chooses their preferred method of testing, and they are taken to the designated testing area. And if negative, the clinician proceeds to offer other PSH services, including COVID-19 vaccination.